Hi, everyone. Welcome back to Facebook Live. I'm Dr. Annette Mercatante from the Clair County Health Department, and we'll be taking your questions live today. First slide for the update. As you can see that we have had a shift in the last week with cases as well as percent positivity. I think the percent positivity is one of the most dramatic things. As cases grow, it does become more and more difficult to accurately capture all the cases. However, you can see that in the past week we've had over 1,400 with about 200 average cases per day that we're collecting. But that case positivity has gone right through the roof. Have we ever been at 30% before? I have to say I don't remember really being this high. Certainly not in the last two waves. So this is obviously a striking change and one that we're going to have to pay close attention to. Next slide. Oh, I should mention the deaths too. So as expected, after delays in cases or case increases, you will see increased COVID deaths. Although these 43 deaths are more likely spread out over more than a week, right? These aren't all that have occurred in the last 7 days, but they've been reported to us in the last 7 days, which is why we report them to you. But still concerning. Next slide. So here's our graph. This um, hopeful decline that we were seeing through December seems to have disappeared. And we're seeing a rapid acceleration of cases. My colleagues throughout the state are seeing similar rapid increases. The assumption is this is being driven by Omicron, although many areas of the state have not officially been notified of the Omicron variant. We do, in fact, have three. Are we up to 7 now? Okay. So we've had several verified genetic sequences reported. Those cases have been generated. Those samples were actually collected actually the week before Christmas and Christmas week, which means they represent infections that have already spread and moved on to other people. So we're pretty close to thinking that if we haven't transitioned to majority Omicron, we're very, very close. Certainly the entire southeastern Michigan, last time there was sequencing, was 60% plus Omicron versus Delta, and that was from samples, again, several weeks ago. Next slide. And this is our vaccination data, which isn't looking a whole lot different. I think the focus with our most recent mask order is obviously the school age group that we're looking at, trying to make sure that their overall vaccination rates are as high as possible. Vaccination rates remain the most effective method of preventing transmission and serious illness. The masks are a useful tool. We'll talk about that more, I'm sure. But we can't really give up on this. And of course, the CDC did just approve the booster dose of Pfizer for the 12 to 18-year-olds. Right? Okay.
15.
Somebody is
17. Yeah.
Yeah. Okay. 12 and up is now approved for boosters. So let's take a quick look at what our vaccination process is looking like. You can see it's kind of slowed down through the holidays. That's not unexpected. We were closed for a good portion of that, but vaccines can still be obtained through us or through your pharmacies or your doctors. Some of your doctors' offices may have COVID vaccine. You can see the lion's share still remains the booster doses, and we want people to continue to seek out vaccines as they become more and more comfortable with that. All right. Anything else on the slides? Oh, we had that one more slide. Yeah, so a lot of questions about why schools. I'm sure we'll spend some time talking about that. But this is there's a couple data points besides the state and national information that made it clear that protecting children in the school setting has value. This is just a review of St. Clair County's cases between November and December. And as you can see, cases, and I'll just caveat, cases continued to change and increase through that time. But there was one age group where cases were reduced, a 32% decrease, and that is in the school age children. We're not exactly sure. We can't prove relationship, but if you remember, we had two school districts put in mask requirements during that time, the month of December. And those mask requirements are the only difference that we can find between this cohort and the one in December. Meanwhile, the rest of the county increased by 33%, but the school age kids went down. So I want this one data point, and I will kind of share some of the other information we have, but lots of information to suggest that masking can do a great deal to reduce case rates, not to mention it helps with quarantine. So let's go on. And then our data dashboard. I also, again, these are cumulative. We're still doing cumulative totals. At some point, we got to stop doing that. But I do want to also mention that on our website, we also have an FAQ section, a frequently asked question, where we're really striving to answer those questions, those that pushback that, hey, this doesn't work, masks don't work, um, masks are harmful, kids don't, kids don't get disease. We're trying to put all of that up in that one place. So if you get a response from us that says, thank you for your questions, please refer to X, Y, and Z, very likely that you're going to find the answer to your questions there. If not, obviously write us back, but we're going to continue to update that FAQ, especially this week. We put some extra information there as well, including some of the school-based data, school-age data. Okay. So I
All
expect I'm going
right.
to get a few questions, but before we do that, Jen, I'm just going to go straight ahead into the talking points,
Yep,
okay?
that's great.
All right. So, the talking points that our staff really wanted me to emphasize, um, uh, well, with the masking issue, we want everyone to know that the better the mask, the better it works. Okay, it is true that a really poorly fitted mask that's hanging down around your chin is probably really not going to help you a whole lot. Um, if everybody masked like that, it probably would not help. But the good news is a lot of people keep that mask up above their nose and mouth. It should be covering it. If you're wearing a fabric mask, it should have a couple layers of washable, breathable fabric. It shouldn't gap too much. It's hard sometimes, but different masks have different fits. So you may want to try out different styles to see the ones that don't mask. The best ones are, I believe, is a surgical mask that have that little wire at the top that you can put around your nose. I got a little tiny nose, and if I don't do that, the mask just kind of falls down. So that would be, a general recommendation. The value of a mask, the highest level of protection is an N95 as you come down, fitted, of course, and then unfitted, and then probably the surgical mask, then the cloth masks, probably then the gaiters, and probably the least effective would be the face shields, especially if the face shield does not have a surrounding piece of cloth around it to prevent a lot of that air leak. So consider that and what you have and what you're comfortable in and what you're capable of wearing, and try these different masks out. Try and find the one that suits your needs the best. Um, Symptoms of Omicron. We get a lot of questions about that. And the preliminary data does suggest that symptoms of Omicron may be milder. That's the good news, and we're really happy about that. This could be an absolute disaster if it was as severe as Delta, but we're getting more and more scientific evidence to support that. Unlike Delta, many patients do not appear to be losing their taste or smell, but a lot of the same symptoms that we've been talking about along cough, fever, body ache, fatigue, congestion, runny nose. So kind of that upper respiratory stuff it is hard to distinguish from other respiratory infections. So testing is still your best way. I realize that testing is becoming a little bit more problematic, especially home testing, which is one of the many issues that entered into our decision-making process about kids coming back to school this year. Um, and Jen, did we have anything you wanted to talk about with the testing At our
Yes.
facility,
Do you have your
okay,
notes in front of you?
there's
It's
nothing
all
on my note about that. That's why I remember we talked about it, but
just about
I'll just
our testing here at the health department
okay.
with not
So
taking home the kits.
yeah, there was some just probably maybe communication is an art, right? It's a skill that we are all getting better at over time. But the oh, do you have it? I didn't have it. So the testing here at the health department is now available. You drive up, you come and get your swab, and you swab your nose here, and then you return it to the uh, bucket or
Bin.
the container, the bin. Is it a bin?
Mm.
Okay. And our staff then will retrieve it within probably an hour. It really can't sit at room temperature much longer than 2 hours. Run your test and then call you with the results. Okay. So it's still rapid. You don't need to hang around for your results. What we don't want you to do is come and grab a whole bunch of swabs and take them home. Number one, you don't have the kit, you don't have the material that you can run it on to know whether it's COVID or not. And if you swab your nose and let it sit all night, it's not going to really be very reliable. So please don't take these swabs home. We're not giving away free kits for home use. We have just kind of expedited our process so you can self collect and drop them off at the same time instead of our nurses coming out to the cars like we were doing earlier. This process has allowed to increase our COVID testing probably threefold. So it was worth doing. But we're pretty much maxed out. We're doing close to 200 tests a day, and given the staff that we have and the resources we have, we're just going to keep trying to do our best. But I want everyone to know that that process is labor intensive, and we want to make sure that you are aware of other testing facilities elsewhere. So urgent cares are still doing them. Jen, why don't you
Pharmacy?
go through this real quick?
Sure. So on our website, secchealth.co, on our COVID section, there's a testing section, and we have a list of resources from all around the county where people can go. So there's places like most of the pharmacies, urgent cares, the hospital systems. You can talk to your own doctor about it. There are many options for testing. So we just want to let people know that we prefer appointments here, not to take the test home kits, our kits home with you, and just follow the directions when you walk up to the door to get your kit. Follow the directions and the signs that we have. Okay? And the other thing, Doc, we just wanted you to talk about was that the boosters are now approved for 12 to 17-year-olds, which
Yeah.
you had already done.
Yep. We're
Okay,
updating our standing orders now, so we should be ready to take those boosters. I don't know if we'll be ready as soon as tomorrow. Do you know if we'll be ready tomorrow to take boosters for 12 and older? I don't know. So call
you
us
know
if you
what?
want your kid to get boosted. Call us and we'll get you in as soon as we're able to. So yeah, there's just some paperwork and some process that has to go into this, but we have the product and we have what we need to get that started. So we should be able to get it up and running pretty quickly.
And people can also self-schedule for those appointments as well
Right.
on our website.
Right.
All right, Doc, there's a couple questions that came in before the show. We always put a notice out. So this person asked, revisiting your Facebook Live question from last week, if a person got their Johnson & Johnson booster but now wants an mRNA vaccine, can they get one? Is there any guidance?
Yeah, I did follow up on that, and thank you for that. There is no guidance at this time for a booster beyond a booster. So if you received a second, yeah, I don't know why I don't have the same thing. If you received your J&J as your primary series, and if I remember this history correctly, then you got a second J&J, and now you're thinking, oh boy, I should have got an MRI. There is no guidance for this at all, unfortunately. We just need more information about it. So I would hold off at this time. I'm assuming you have a good amount of memory protection. Do your due diligence to avoid exposure, and as more of that information comes in, we'll be sure to share it with you. But there was absolutely no guidance on a booster dose beyond a booster of any kind. So,
All right. The second question, which you already talked a little bit about masks, but this person wanted to know, many parents are concerned about the long-term effects of students wearing masks, especially for
right,
young children and their development. Is there any
right.
information on the long-term safety of young children wearing masks that you can share with us to put our minds at ease? Thank you.
Right. No, and that is a concern. There are obviously short-term studies that indicate that masks are safe for individuals, even individuals that have kind of advanced respiratory disease. Is there a long-term study? Let's see. I'm looking at 8 days, 14 days. Yes. So there is a nationwide analysis of data collected July 1st through September 4th. Again, that's not super long. That showed the safety of a mask. I do have a lot of this. Every study that we have been able to use that we believe is valid and reliable is on our website now. We've linked it to the CDC sites that have mask studies. Um, Here's the thing about masks that is important for all of you to understand. Number one, your kids aren't going to be wearing masks 8 hours straight, right? They're going to remove their masks at recess. They're going to be removing their masks when they have lunch break. They're going to be allowed to have mask breaks. So it isn't like they're using a 8 hour straight mask. The second thing is there is an automatic, we have not instituted this mask requirement for the rest of the school year. Hopefully, it can be expired at the end of the month. We'll watch the numbers, and if it's possible to rescind this even earlier, we will. Number three, and probably the most important piece, the risk of COVID to your child is significantly greater than any theoretical risk we could even come up with for mask wearing. So, although the data is not um, absolutely there as far as we know, we have all of this stuff lined up, and it'll come over time. I know it will. We have to weigh that risk and benefit situation for risk, and the risk for our students having a large increase in cases as soon as they return to school this week is very, very great. More importantly, we are seeing with Omicron a rise in pediatric hospitalization rates. Probably not because the Omicron is more serious to kids, but there's just a lot more kids getting infected. So increase in hospitalization rates, which is obviously really bad for your kid. And the third issue, which we might as well talk about it now, is that masking will prevent your kid from having to quarantine. We feel that masking provides enough coverage that the risk of staying home, and there's another one of those risk benefits, the risk of staying home for at least 5 days, if not longer, is going to outweigh the any theoretical risk of a mask. And there's been nothing to suggest that long-term use of a mask could even cause a problem. To answer your question directly, I don't know if there's any long-term study. Now, I don't know what you mean by long-term, longer than 30 days, longer than a year. I'm not sure what long enough is at this point, but nothing has suggested a problem. Um, with the exception, and I will say this, one of the areas that we're watching closely is the covering of the face, especially the mouth, in children during their early developmental stages when they rely on facial cues and the face to provide them developmental learning and things of that nature, which is why we've held off on requiring masks for under 5. There's a lot of information that even suggests that is not as serious as we may think, but there is a little bit out there that would raise our level of caution. So, steady as we go, we weigh the risks and benefits, we go slow, we provide our kids the best coverage that we can for what we know.
All right, and the
Okay.
last question that came in last night was this person said, I have an eye appointment tomorrow and was told by my friend that there were workers that don't wear masks at this office. Isn't this required by them to do so?
Healthcare providers are recommended to wear masks. I believe there's still some OSHA requirements in place that require that. I don't believe they've expired. If your healthcare provider is not providing you that level of safety, you may want to seek out an office that does. That's all I can say. We get complaints, we move them forward, we send them up to the state if they're repetitive and egregious. But quite honestly, this is a choice that a lot of our offices and healthcare providers are making independently. And you have to decide as one of their patients whether you're comfortable with that or not.
All right. So we have a lot of live questions, Doc. So just wanted to give you a heads up on that. We're starting with those right now. Okay, Andrea, she asked, when will the Pfizer booster be available at the health department for 14-year-olds? You covered that already. People can call our health department phone number or they can schedule online for the
We have
appointment.
we have the Pfizer product, so it's just a matter of getting our standing orders updated to include that age group and include all the ACIP recommendations. So that should be very, very quickly. I don't want to say tomorrow, but it should be up very quickly. So yeah, give us a call or go ahead and get that scheduled, and we'll get it done for you.
Bonnie asks, should organizations limit large gatherings, 50 to 100 people, even if they wear masks? What are your thoughts?
I think they should. All right. I am watching this climb. We're watching what's happening in Florida, in New York, and some of the states around us. This is a challenging surge. There's a lot of COVID fatigue. There's a lot of resource restrictions. I mentioned masks. This virus does not respond well to two of our three monoclonal products. We don't have an ample supply of our antivirals yet. I think that's going to open up eventually, but we don't have it now when we need it. And the cases accumulate very, very quickly. This is a highly infectious virus. So even though it may be milder, because there are more people involved, there are going to be more numbers of people who are going to require treatment and who are going to get more seriously ill. So, in the next 4 to 6 weeks, would I be careful? Absolutely, I'd be careful, even with masks, even with everyone being vaccinated. That's the other thing about Omicron that's very concerning is that it is not vaccine is not as protective, nor is previous infection as protective as it was with the Delta. So we just don't have the confidence, at least I don't have the confidence that we did 6 months ago to say, oh, if you've been vaccinated, wear a mask, you can do anything you want. Um, when our rates come down, I think I'll be willing to say that. But for now, I would try and keep it small. I would limit the amount of eating and drinking that's done as people mingle because they have to take their masks off. And I would try and keep it where the physical distancing and the time that people are together is limited.
All right, the next question is from Eva. She asked, how long should a vaccinated person that's been exposed quarantine?
Okay. We still have the formal CDC guidance that a fully vaccinated individual who's had an exposure does not technically need to quarantine. They can continue with their daily activities. But I just mentioned this. This virus is not as the vaccine is not as protective. Boosters help a lot, by the way. Boosters bring it back up to like 80%. But if you've just had your primary series or you have a little bit of that immunocompromise, it's not going to give you that big bang that it was at the beginning. So you are going to want to be very careful after your exposure. You need to think about your circumstances. If you have an elderly sick grandmother or a kid that's got a cancer is under treatment, you still don't want to go near them, even though you've been vaccinated. You still want to use that quarantine period. Remember, the quarantine period remains 10 to 14 days as the outer limit of when you would develop symptoms that will let you know you have COVID. Um, you can move that up now to 5 days, according to the CDC. So you can end your quarantine after 5 days, and to add to the safety, you can do some testing in between. So it's getting a little complicated, but the bottom line is if you've had exposure, and I will just say at a 30% uh, infectivity rate, there's a good chance you're going to have exposure anytime you go into a crowded place, especially a crowded indoor place. Then you have to weigh your odds. You got to say, okay, I've had this potentially had this exposure, but all I do is I go to work and I sit in my cubby and I do my and I talk to my coworkers and I wear a mask. You want to definitely wear your mask even though you've had a fully vaccinated exposure. You want to use your mask the full time, and then I would add in the testing to it. So the answer is not really straightforward. The answer is if you're fully vaccinated, you don't have to stay home, but you still need to be very, very careful over the next 14 days. Excuse me, the CDC just changed that to 10 days. I got to get used to that. So 10 days is now the official duration of quarantine. Okay. which is nice because it correlates with the official duration of isolation as well. It's the same time frame that you want to avoid people when you're COVID positive. Okay.
Okay, Jennifer asks, will you offer drive-through testing clinics?
Right now we're doing about as many testing as we possibly can. If the need exceeds our ability to do what we're doing right now, we need to talk to our community partners and see if that's something that's viable. So it's not off the table. We haven't talked about it yet, although today we had our first conversation about how we've kind of reached our limit with the amount of tests we can do daily with our current system. So, which is kind of a drive-through system, but not exactly. So the weather's cold. That makes drive-through even more challenging because you need an indoor space and lots of things to consider. But we will continue to watch that and see if we can find better options. The other thing that everyone needs to be aware of is that even amongst official organizations like ours, we are starting to receive some indications that there is overall a nationwide problem with getting unlimited testing. So obviously it's a problem and over the counter in the stores. So far, we don't have any problems with limitations, but as we talk to the state, they're starting to give us some signals that we need to be efficient with our testing, which is another great reason we don't want you to just grab those tests and go home with them. Okay, we really need to apply these tests most efficiently as we can.
All right. Um, Penny just stated, thank you for all the info and all you do to keep everyone safe. Thank you, Penny. Stephanie asked, what other illnesses are going around?
Flu, mostly flu, I think, as far as respiratory. Haven't seen a lot of reports on RSV. Are you seeing anything? I haven't looked at that CD report in a while. Uh, but flu, definitely flu. So there's the other piece that's concerned to us. So you talk about the perfect storm. We talked about high infectivity rates, low response to vaccines, monoclonal antibody therapy that no longer works, antivirals that we don't have yet, kids going back to school, where we know historically every time kids go back to school, there's a rapid increase in cases. And now we have a super imposed influenza wave that's very likely to hit us. It's definitely hitting other places. There's no reason to think that Michigan is going to escape an influenza season this year. So it is starting to ramp up. I can tell you, and many of you may know people already that have been diagnosed with influenza already. So when you get sick, your provider does need to consider both of these things. Treatments are different. Okay, we don't screen for influenza when you're here. It's COVID, yes or no. All right. So if you think you might have, if you come here and you get COVID tested and it's negative and you're just sick, go to your doctor and get an influenza test or whatever else they may want because you may need treatment for something else. There is co-infection going on. Absolutely.
All right, we've had some other positive comments, but since we have a lot of questions, I'm just going to go to the questions. Denise asked, how many people got their first vaccine last week? I think she's asking.
No. 365 is
Okay.
what our data guy says. Thank you, Brandon.
All
God
right.
bless you.
Yeah, thank you very much, Brandon, for everything. Amanda asked, what impact, if any, does it have when surrounding counties do not have mask mandates?
It has an impact. It has a bit, and we did weigh into that. I mean, obviously, we have schools of choice. We have people coming into our county, but our our responsibility as a health department is to St. Clair County. We had to weigh that against any potential risks. I did talk to our colleagues. Some of our surrounding counties do have mask mandates: Wayne, Oakland, Detroit, but as you know, Macomb County does not, nor does Sanilac or Lapeer. So it's unfortunate. They felt that they couldn't make that next step. There's obviously a lot of uh, grief surrounding doing something like that, but we felt that it was important enough to make that move and to at least try. If we didn't try, we'd never know if it would help or not. So here we go.
All right, Nancy stated, Henry Ford has 700 staff out with COVID, 430 out of Beaumont. How are we doing in St. Clair County hospitals?
Okay. So we actually have a meeting scheduled early next week, specifically with our hospitals. They do not report directly to the health department on these issues, although my data person does say that two of the three are reporting staffing critical staffing shortages. So yeah, there's the other critical piece that um, most people don't consider. So this has an impact not just on you if you have COVID, but for you if you have influenza, for you if you have a heart attack, for you if you're in a car accident. These issues can spiral very, very quickly. So we are having some difficulty. I don't have the exact numbers as far as staffing goes, but I strongly suspect all of our hospitals will struggle. Um, and I don't know how we're going to avoid that. We're just going to have to get through it, which is another reason every person in this community needs to do their share, step up, and do what they can do to avoid getting infected. Right? Everybody is partly responsible for how well these next 6 weeks are going to go.
All right, this next question is from Heidi. My daughter dropped off my grandkids at their other grandma and grandpa's house this morning. The grandpa went to the doctor this morning for sore throat, came home and was positive for COVID. The grandparents are fully vaccinated and wasn't by the grands.
Okay.
My daughter picked the children up ASAP. Do they have to isolate for, and if so, for how many days? The children are 3 years old and 8 months.
Right. So they're too young to be vaccinated. They're too young to be wearing masks. They're just young children that may or may not have had exposure. There's a lot of like how close were they to the grandparents and how long were they near the grandparents, et cetera, et cetera. And by the way, good luck to your, is it your dad, your grandpa? Um, Hopefully, as a fully vaccinated individual, his symptoms will not be overly severe. So I wish you well. With the kids, when you say isolate, I'm going to go back. I'm a stickler, but it's confusing to people. So isolate is when they're sick or when they've tested positive for COVID. If they were positive for COVID, regardless of their vaccination status or anything else, you want to keep them home for a minimum of 5 days. It's the new CDC guidelines. And for the remainder of the 5 days, if you can't mask them, you have to keep them home as well. So if you can't mask, you stay home for 5 days and you mask for the remainder 5 days. An 8-month-old and a 3-year-old are probably not going to be able to mask. You probably need to keep them home. Now, that's if they're sick. You're asking, do they need to quarantine if they've had that exposure? And that really depends on how close they were to grandpa. His vaccination status doesn't matter anymore because he's tested positive. So I would ask, is it, when you take them to daycare, what is their policies? Ideally, I think if that exposure was close, they were sitting in grandpa's lap for an hour watching a movie or something like that while he was infectious, you'd probably want to keep him home for about 5 days just to watch him carefully. Okay. You have to weigh that against what your needs are if you're a working parent. And then you have to have that conversation with your child care facility, et cetera. I'm hoping that child cares are going to add another layer of protection from their staff and maybe even physical distancing so they can kind of keep these kids from being really far apart, really close together, just again over the next 4 to 6 weeks. But what you're experiencing, I think we're going to see very quickly. We're going to see an explosion of cases. So it really depends on your circumstances and how well you can stay home. If you can keep those kids home for 5 days, and by the way, children and infants can get COVID and they can spread COVID. That issue has been pretty definitively settled in the literature. So even though they may not get as seriously ill, they could still be shedding that virus, which is another problem there with the little ones, right? They could be shedding virus when they go to their daycare, and you may never know they're sick. Testing is an option. That whole idea of testing them regularly if they do go back, but testing can be a problem, especially in little ones, especially when you don't have home kids. So I don't have a great answer for these questions. I think we got to use our heads if much as possible, try and keep exposures home for a minimum of 5 days. And if that's not possible, try and provide some testing as they go back into the world. And then beyond that, we just got to start making some tough decisions, right?
All right.
Okay.
It's Doc, it's 4:05 and we have a lot of questions,
I
so
know we
I'm
do.
just want to keep going. Okay, the next question is from Donna. Do we have any info on how and when the at-home test for the government will be available? Thank you.
I know, and I am praying for that. I think it would be a blessing for us with these questions. They have a couple tests at home. When you're not sure about something, just run that test. It's so reassuring. I used some tests a couple times over the holidays when we were gathering, and I know it's not perfect, but it is a very reassuring thing. No, the answer to your question, I have not heard what's going on. There is a breakdown in communication, I would say, from the federal level all the way down. We're trying our best to communicate with you, but even the testing supplies from the state, there seems to be a problem with them shipping them out. I think that's been resolved. They told me they don't have a shortage right now, but they're looking at perhaps a nationwide difficulty in obtaining tests. So I don't know. I don't know. The next month or two is going to be a little dicey with all of these things. This is when we need the tests, right? I'll be I don't want to be super critical, but this is when we need the tests, is during a surge like this, when people need to continue to work and provide for their families and live their lives. And all I can tell you is keep looking for them. Keep looking for them.
Okay, Amanda asks, is the county providing masks to the schools or do they have to go through MDHHS?
That question was asked yesterday to me as well, and we no we have, well, when we get extra tests, we have absolutely provided them. Early in the pandemic, we were getting box loads and we were sending them out to as many people as wanted them. If a school needs masks, I talk to them regularly, and no one has asked me to find them masks. So my assumption is schools are supplying masks to children who are showing up without them. That is what I've been, the information I've been receiving, pretty much from all players from all the different school regions. If that's not the case, please contact me and we'll work on finding you some for that reason. I think there's ample masks out there. I think we just need to make sure that if there's a gap, that we identify it and fill that gap for you.
And we really do ask people to contact us through the COVID-19 at stclaircounty.org email
Mhm.
and also the hotline 810-966-4163. Okay, the next question is from Darlene. She said, "How soon can someone be around? How soon can someone be considered okay to be around other people after they tested positive and received the monoclonal antibody infusion for COVID? Do they need to have a negative test first? Still loss of taste and smell, or is it the CDC 5-day rule?"
It's still the CDC 5-day rule. Okay. Now, if you're still symptomatic, seriously symptomatic, you still feel achy and your energy's gone, I would take that out to the full 10 days, even beyond if you have really severe symptoms. But the monoclonal antibody infusion doesn't really impact your isolation duration. Okay. What that treatment does is hopefully provide you a less severe infection so that you'll recover more quickly and feel better more quickly and not end up in the hospital. The real value there is it drives down hospitalization rates pretty dramatically. Now, what was I going to say about that? So it's okay to be around people after 5 days, assuming you're feeling good. Oh, the testing. There's no one recommending test out for isolations that I've seen yet. There's some studies out there that might suggest a negative antigen test might be helpful, but quite honestly, there's not a lot of certainty about how reliable a test is. And remember, a PCR test, a molecular test, can stay positive for weeks and it has no bearing at all on your infectivity. So whatever you do, don't get a PCR test because those can stay positive for a long time. And we know that those don't reflect your infectious nature. Antigen tests might be a little different, but I don't have any guidance right now to share with you about that. So I would just use the duration and how you're feeling to guide you with that.
Okay. Rose asked, when are 12 and up boosters ready at the health department? We already covered that, but Rose, just give
Yeah.
us a call here at the health department or you can schedule online as well. Emily asked, why is it that Macomb County has a higher positive rate and still not mandating masks for schools? How do we get our health department to protect our kids in our communities?
Well, we think we are protecting our kids and our communities with our
I
mask mandate.
I think
I think
she's
that's what they're
referring to Macomb County Health Department.
Macomb County. Oh, I see. Have we looked at Macomb's numbers? First of all, Macomb has a totally different environment. They don't have any rural environments. I don't believe they have much rural. Maybe a little bit up in Richmond, but not much. They have a lot more people than we do. And so case counts can be kind of misleading. And I guess this is a good time to say that when we get into case counts in the hundreds and the thousands, like we're getting into now, don't rely on case counts. They're not going to be reliable. Okay. They're just not. We're not going to capture them. We're not going to be able to report them out to you. You have to assume that 30% of the individuals out there potentially have an infection. And remember, that's not going to be 30% everywhere you go. In some places, it's going to be a much, much higher rate of infection. And in some places, it's going to be a lower rate of infection. So that's the problem we get into with pockets where we'll have a burst in one place and not the other. So to answer your question, how do we get health departments to get online? This has been one of the most challenging, difficult 2 years I think any of us in public health have ever experienced. Um, there's public health science, and there's medical information, and then there's finances, and then there's politics, and there's a lot of crossover with that stuff that makes some things possible for some health departments and other things not possible for others. Um, so I talk to people. If you have a specific desire, you would like to see more protection for your kids when they're in school, um, talk to your school superintendents. And by the way, your boards of education often drive that decision. Schools still have the ability to require masking in their schools. All right. I would also um, send messages to your commissioners, and probably your health department people too, although I know your health department people already know that this would be a good thing. But it's challenging for them in different counties. And we have many counties. Right now there are only 8 counties that have mask mandates. Now that's a lot of people, but that still, you can see there's not a blanket response to this. People are all responding in different ways, which adds to the confusion, and it adds to the chaos, and it adds to the anger, I would say. So it's unfortunate, but that's just the world we're living in right now.
All right,
What?
Kelly asked, excuse me, sorry about that. Kelly asked, how long after a vaccine are you considered okay?
So, to be fully vaccinated, the CDC is still calling it a full primary series, 2 weeks after the last dose of your full primary series. Okay. However, the effectiveness of these vaccines is reduced with Omicron, and we are encouraging a booster. So it would be 2 weeks after the boost, 2 weeks after the booster. They haven't changed. 2 weeks after your booster is when you're going to have the maximal protection. Now, we were a little uncertain about natural infection. Remember, we have many times talked about 90 in the past 90 days. If you had a natural infection, that would be considered the same level of quarantine exemption, if you will, as being fully vaccinated. There was that disappeared for a while from the CDC, and now it's back. So I would say that a recent infection within the last 90 days offers you a pretty decent amount of protection, but probably not as good because your previous infection was not to Omicron. Omicron has just arrived, and your previous infection was very likely a Delta variant, because we've had those around since September. And we know there's a huge difference between these two virus strains. So right now, if you got a vaccine today, it's not going to help you through this next surge. I'm sorry. Unless it's a booster and you do nothing for 2 weeks. That's why another reason why we had to rely on things like masking and physical distancing, because if everybody vaccinated today, it would still take, for our kids anyways, right? What would that date be? February, late mid-February before they be protected. And quite honestly, we don't have that kind of time. This is going to hit us soon. Soon.
Okay, this is from Kathy. Since my Moderna booster in October, I was diagnosed with cancer and am in treatment. Should I have received a full dose of Moderna instead of a half dose, as now considered immunocompromised?
No, the booster for Moderna is always that half dose. That's the dose that they've determined is most effective for that particular formula, for that particular vaccine. Um, Now that you are immunocompromised, you've already been boosted. I don't believe there's any further recommendations for your mRNA if you've received 3 doses. The thing about immunocompromised people is they can receive a third dose of their mRNA vaccine as a primary series to get them fully engaged, and then they can get a booster. So, I don't know whether you had your primary series 2 and then a booster 6 months later, um, but I think you're done. I think that's pretty much it. You know what? I'd love to check for you a little bit more because I'd like to provide you the best protection you can. And I got to be honest with you. I know a lot of people are going off official recommendations and getting extra vaccine, but there's absolutely nothing to guide us. But if you could send us your name and contact information, Kathy, I will double check that with our CDC immunization folks and see if there's anything else you should be considering. But it's not about the full dose, half dose. That's the appropriate dose for a booster. It's really whether you would be considered a 3 dose candidate and could get another dose after this. So I'll try and get that to you, and that's a great question. I'll see if I can do.
Okay, Amanda said, ask, what threshold was the case rate positivity that triggered the temporary mask mandate?
It wasn't a case rate. Okay, so in August to September, we saw a really dramatic change in case rates in our school age kids. So at that time, Delta was starting. There was a lot of pressure, lots of reasons. Maybe in hindsight, there should have been a mask mandate then. There wasn't. And we went from a 9% positivity rate in school age kids in August to a 25% positivity rate in September. So dramatic change when kids first come back. And then, as you see in our graph, cases just grew and grew in all age groups. And then in all age groups, the number of cases increased. Proportionally, that school age group kind of gradually went back down because everybody else was getting sick at that point. So we have that information, and then we have the information I shared with you earlier locally that there was a decrease in school age children case positivity after 2 of our school districts, which represent about 47% of our kids, put a mask mandate in place. Again, it's not absolutely cause and effect, but a couple of really good data points. But to your question, it was not the case positivity rates in our schools that prompted this mask. It was the impending Omicron with all the variables I just shared with you about monoclonals and vaccine and immunity, overlapping flu, poor vaccination rates, and the fact that our kids were coming back from school, excuse me, from the winter break, just like they had in the spring, the summertime to the fall, anticipating, honestly, quite knowing that there's going to be a sudden surge. We want our kids to stay in school. So current guidance is after an exposure, any child who's not masked or fully vaccinated needs to stay home. And if enough kids stay home, schools can't function, right? They get that threshold. There's not enough kids there to legally stay open. So I've said this before, pauses of schools have never been driven by me or public health saying you've got a problem. They've been driven by the functional operational capacity of those schools. So we do, in fact, anticipate an explosion of cases in the schools and everywhere else. But if every kid that's in that classroom doesn't have to quarantine every time there's a case, there is a possibility that the schools will stay open. So this is twofold. The mask mandate is twofold. One, just the protection of our children, knowing that will reduce some of the transmission and keep some of this infection down, although we don't anticipate it's going to make a noticeable difference with the cases exploding. Hindsight might guide us a little bit more, but the second fold is going to hopefully keep our schools from pausing really quickly. And if you are watching the news at all, you know that hundreds and hundreds of school districts are pausing because of the explosion of cases. So that's really our goal, is to keep our kids in school and overall to protect our kids as much as we can, and allow them to continue on with their lives as much as we can.
Um, Barry asked a question that's already been asked, but one of his second part of his questions was, how does a St. Clair County student go about getting an exemption from wearing a mask every day?
You can talk to your physician. We are, I think all the school districts are accepting valid physician exemptions. There has been a couple times where they've called me and said, "Hey, what's this?" But I don't know your student, so I'm not deciding exemptions for masks. It would have to be up to your healthcare provider. Now, we also have students that struggle with disabilities, etc. There are carve outs for those already. But if you have a healthy kid and you feel that there's some underlying condition that would make it difficult for him or her to wear a mask, you need to have that discussion with your healthcare provider and see if they'll give it to you.
All right. Andrew asked, I've taken 3 Meijer 24-hour rapid tests done, spread across a week, and every result was positive. I took a PCR in the middle of the week and the results was negative. How long can I test positive?
So this comes up a lot, and it's really hard to know which tests are being ordered, whether your swabs were accurate, where they were done, the technique, etc. But the reality is those are two different tests, okay? And it's more likely that 3 positive antigens in a row means you really did have COVID, okay? The PCR tends to go away. It's a little bit, it identifies the genetic material. And so if you're doing a PCR more than 24 to 48 hours after your antigen test, it's possible that the amount of viral load is just decreasing to the point where it's not going to detect it. With 3 positives, I would call yourself positive, and I would isolate for the 5 days recommended by the CDC and wear a mask for another 5 days.
Okay. Neil, quick question. I understand the mask mandate for schools is to protect the kids. If that's the case, why haven't you instructed all businesses to do the same, as adults are most at risk?
Yeah, because we care a lot about our kids, and as I mentioned earlier, um, well, there's a couple reasons. So the broad reason is that when children go to school, leadership, school, and public health is responsible for assuring that they're going to school in the safest environment possible. That is their responsibility. So, as a parent, when you send your kids to school, as soon as they walk over that threshold, it's the school's responsibility to do the best they can. And there are many, many people who don't want to wear masks, but there are a lot of people out there that really they want their kids to be able to continue to have that protection when they're in school. So, the mask mandate hopefully will extend that so that more kids have that ability. The second issue is the one about I just mentioned about keeping kids in class. All right. We know a lot about, well, I shouldn't say we know a lot about everything. We know more than we used to. And there's one thing that's very clear from last year's shutdowns. Okay. It was bad for business. We know that. But it was really bad for kids. All right. We don't want our kids to have to go back to virtual or remote learning if at all possible. And given the masking criteria and the ability to forego stay at home quarantines after if they've been exposed with a mask, this is going to allow all of our schools to stay in person, at least for now. The only way it's going to flip is if there's just too many sick people. And then we're going to have the same problem. But it has completely eliminated that issue of for every case, you got 10 quarantine kids. For every case, you got 20 quarantine kids. We were seeing that over and over again. And it was the quarantines that were killing everybody and making the schools really suffer. So this has been a game changer for our schools. None of them are talking about pausing right now. And I think that is more than anything an immediate win. The broader win is that we have enough evidence, both locally and nationally and globally, that it will reduce the burden of disease in our kids to some level. Now, why not everybody? Now, I'll just say this. Everybody should be wearing a mask. I want all of you guys to wear a mask. But there is this balance between public health authority and what we should be doing and what we can do. As you know, there's already a firestorm about doing this for our K through 12s. We felt that it was out of all of our populations, our children are one of the most important things to protect, and provide that safety net to. So that was our decision. Um, but I think you're right. I think every single business and adult should be wearing a mask. And if you're not, that's your choice. But I think you're putting yourself at significant risk right now.
Okay, Doc, just to keep you in line with the time, it's 4:24. Tracy asked, what are community partners doing for homebound and those who rely on the bus can do if they need testing or treatment?
Community partners doing for homebound, and okay, so it's still required to wear a mask on a bus.
I think they're
Do they need
asking about like
testing or
homebounds. If someone's homebound, how do they get a vaccine, etc.?
Okay, so if you have somebody that's homebound and they need a vaccine, a booster, we had a system in place for the primary series. I think that's kind of fallen apart a little bit. So we would want you to send us your name and contact information. We meet with them not regularly anymore, but if we can collect a variety, if we can collect a group, I think we can push that issue a little bit and see if we can get some boosters out there. We'll work on that for you.
All right.
Oh, and by the way, you can talk to, I'm assuming homebounds have visiting physicians or some other form of home health care work. Talk to them and tell them how important it is for them to assist with this vaccination process. They can get vaccine real easy. This is what we are doing. It's just really about policy and process and workforce. And everyone's struggling with workforce. But if these home healthcare systems are hearing from their clients saying, we need you to vaccinate mom or dad or Joe, hopefully it might resonate and hopefully they'll know to reach out to us to work on that issue.
Okay. Jerry said, I have a coworker who has continually tested positive since mid-December. Is this normal?
No, well, yes. I said there are a percentage of people, and I've lost track of what that is at this point. Do you remember what the percentage is? Uh, we are not recommending repeat testing, and this is why. Because some people, and I'm assuming they're getting PCR tests, um, PCR tests can remain positive for months, but that does not confer the same level of infectivity. Now, if it's antigen testing that's still positive, I would think twice about that a little bit and wonder if this person is immunocompromised. Antigen testing generally doesn't have a false positive, not that it can't, but it generally doesn't have a false positive. They're more likely to be falsely negative. So, especially in a high transmission rate like this. So, Jerry, I would recommend that individual go see their provider. I hope they're not doing PCRs. The bottom line is that they're probably not infectious. And this goes back to what I was saying before. I don't want to give you guys any advice about testing out of isolation. If you're positive for COVID, wait your 5 days, throw your mask on for the not for the remainder of the 5 days, and assume you're good. Okay, so you start throwing testing in there. There are so many variables with testing that it becomes just a nightmare challenge. So there is no clear advice at this point about testing out of isolation. Now there's testing out of quarantine. If you have an exposure and you want to get back to work quicker, there's all kinds of variables and ways of testing out of that. But if you're positive, we're just telling you to wait that minimum day. If you have a significant immunocompromised condition, those people can stay infected for weeks. We do know that, but it's rare. It's really rare. And in those situations, you probably want to have them consult with their physician and see what's going on.
Melinda asked about how bad does it have to be before they go virtual schools since other counties are going virtual for the next week or two? I know the mask mandate you had said earlier was to help kids stay in school.
But if there's
Not
enough
sure they're
cases,
going
they
to do it.
won't. So schools need a is that minimum of 75%. I'm sorry, I don't know the exact number. They need a minimum number of students to count it as a school day, number one. Number two, they need staff to run their school. This became extremely problematic toward the end of November which is what prompted two of the schools anyways to go this direction, between the quarantines off and then the teachers off, that you can't run a school without teachers. They couldn't even find subs. So these are the issues that are going to be bad. It's not going to be a absolute number. It's not a threshold if you get above this. It's really about what that school system and that school building is able to do with the resources that they have. Um, so a lot of schools are closing. I'll say this because they don't have a mask mandate and they know a single case, and there's not going to be a single case, there's going to be multiple cases, are going to result overnight in dozens and dozens of kids that are quarantined, and that's going to overnight cause this. So there's a kind of a preemptive pause, or I think people are trying to figure out what to do. I'll just say this because it's really hard to do a mask mandate, and I know you guys know that there is a real significant pushback. Um, it's hard to do. It's really hard to do, and some communities maybe don't have the ability to do it. That's all I can say. I think we're really lucky. I think this is going to keep our kids in school, at least for a while, and hopefully long enough for this peak to come down. Here's the other thing: Omicron is scary and it's big and it's quick, but the quicker it goes up, the quicker it's going to come down. I hope. We hope, right? That's generally what the epidemiology tells us. So I don't know what to think about the Delta piece, although there's some issues, and once Omicron hits, the Delta goes away. But we could be in really good shape by February, okay? Maybe even early February. So I'm hoping that these things that everyone is so concerned about will at least keep our kids in school and keep our teachers in school and help us limp through this next wave.
All right, Doc. I just scrolled down, and there's a lot of different things happening on the feed right now. So I'm going to end you with this last question, and then anyone who has a question we didn't get to today, please email us at
Mhm.
covid19 at stclaircounty.org. The
Okay.
the feed's kind of turned into a battleground per se. So the last question for the day, and we'll be back next Thursday. If you have that, or email us before that. What if a child has COVID a month ago and now a sibling of theirs has it? Do they all stay home again?
No, I think we're gonna I think that 90-day rule is gonna still hold up. Okay, that if they've been sick within 90 days and they have another exposure, i.e., because the sibling's sick, they can continue to function. Just be careful. I go back to that idea. It's not a guarantee, and you want to be wearing that mask. Those kids should be wearing their masks when they're around, where they're indoor buildings. School, we don't have to worry about right now for now. But if your kids going to play indoors with the other group of people, they should be wearing their masks for the next 10 days. Okay. But still, no need to quarantine after a recent infection.
All
Okay.
right.
I'm just going to
Anything
say
else,
one more
Doc?
thing.
Okay, go
Yeah.
ahead, and then we're
I
going to
just want to
say
say one
goodbye.
thing. And I know because I can only imagine what that battleground is sounding like. So thank you,
Yep.
Jen, for keeping me.
Yep.
So um, I'll just say a couple things. Our team came to this decision through a lot of study, a lot of heart wrenching discussions, and a final decision that we had to do what we knew was right, given our responsibility and our professional judgment. Okay. It was our responsibility to make this call. We just talked about why some communities are and some communities aren't. So we made this decision because we care about our kids, and we care about our kids enough to try and do something, knowing that we've got this perfect storm brewing that's going to have a profound impact, not just on our kids, but all of us, but trying to protect our kids to some degree. So, number one is because we love our kids and we're trying to do the right thing with our kids. Number two, we should all be fighting to prevent disease infecting our kids. All right. That's a thing that I struggle with. Why are we fighting so hard to allow our kids to get exposed to a potentially deadly virus? Let's just think about this. It's a face covering. We talked about that. There is nothing to suggest there's any terrible harm that's going to come, and we know what's happening to kids. Hospitalization rates with Omicron, pediatric hospital rates are climbing. Last I saw was 40% increase. So we have more kids getting sick, and as a result, even though it's not really severe, we have more kids getting sick enough to be hospitalized. That is a serious concern. So we put coats on our kids when it's cold outside. We have them wear boots when it's wet. And when we have a deadly, horrendous viral surge, we ask them to wear a mask. And this is really not, this is not tyranny. It's not an overreach. It's just sound, caring public health, compassionate policy. Okay. So I'm just going to say that that's our position. We can agree to disagree, but I think we've got a lot of solid feelings that we did the right thing, and we're going to stay the course until we can see where this surge is going. So good luck to all of you. Stay calm, deep breath, find some fun, kiss your loved ones. Uh, I do think, and I don't have a crystal ball. We don't have a crystal ball, and we're doing this because of a concern about what's going to happen, but obviously we don't know everything. But I do think this might be our last bad thing for a while. Maybe even for as COVID becomes endemic, we'll only see small little bumps and surges. I'm hoping this is our last really horrendous surge. And if I'm right, we can all take a deep breath. We can beat up on each other. We can look back at the data and see how much impact we had. But moving forward, we feel it's important to take care of our kids. So with that, thank you very much for joining us, and I'll see you next Thursday.